My name is Dietrich. I'm a research fellow with the United Nations University, the International Institute for Global Health, and we are based in Kuala Lumpur in Malaysia. The focus of my work is within the Institute for Global Health. We have a number of priorities. One is urban health, and one is governance for urban health, and the other area which overlays both of those is a focus on planetary health. My work in particular at the moment is organising an urban thinkers campus with a focus of health and well-being for the city we need. We are trying to influence the Habitat 3 agenda by refocusing and looking at the issues that are raised already, but through a health and well-being lens. The top priority for the new urban agenda? Well, coming from an Institute for Global Health, I must say for me it is the health and well-being of the people in cities. When we look at urban development, sustainable urban development, cities can only thrive if the people in it are healthy. And the only healthy people can make cities thrive. So for me it is the health and well-being from all aspects, whether it is economic, ecological, or from a social perspective. I think that's quite a critical role that the universities can play, and that is on multiple levels. One is including the goals of the new urban agenda into their own curricula, but also in their industry partnerships, promoting those and capacity build into the community, and also focus on transdisciplinary education and transdisciplinary events, getting all different perspectives together. Because when we look at the city and how it can develop sustainably, it is such a complex issue. And as we know from complex adaptive systems theory, is diversity is key. So diversity across disciplines, but also transdisciplinarily. Capacity building in my work is that we produce e-learning materials that can be at no cost, so to improve access to to the latest information for other tertiary institutions, or just simple for anybody who has an interest in that area, on sustainable urban development with a focus on health and systems thinking. In terms of further capacity building is working with other think tanks and other networks in promoting this information and finding partners and alliances to further identify research priorities and implementing those in the future, and then having a feedback loop of those into policy for UN nations. I think the new urban agenda will identify the new direction for the next 20 years. And of course we need to bring our partners, cities, governments and universities along with those priorities. And so the role of capacity building would be to communicate. I think communication at all levels, to make sure that everybody is on the same page in terms of their work and being able to incorporate those that new agenda into their own core business is key. I think capacity building at my institute would, in addition to developing course material, is in influencing other think tanks and networks and communicate with those in promoting health and well-being in sustainable urban development. It has a 20-year framework, so I guess the role of Habitat 3 is in facilitating the implementation of that agenda, but also constantly look for new priority areas and facilitating, I think, the integration between the different priority areas and issue papers that are identified to represent or to connect those, because in the city as a complex environment requires a holistic approach to take.